Lovely. Just while we're waiting for the slides to come up, we'll just do some quick introductions. So my name's Beth Kimberley. I'm one of the partnership leads for Maximus, and I'm going to be delivering today's presentation alongside my colleague Kaylina for you today. So would we be able to just have the slides up, please? Lovely, thank you. So just a little bit of housekeeping to get us started. So you will get a chance to do some Q&A at the end. So feel free to post your questions throughout, or perhaps just hold that thought in case we cover it and pop them in at the end. If you're listening to this as a recording, then Kaylina's details will be at the end of the presentation, where you can reach out to us and get some extra consultancy after the session. But for those of you who are listening in, you'll be able to get our leaflets, posters, these presentation slides, all as a download as we go through. Next slide, please. Okay, just while we're waiting for the next slide, I'll just start talking through the service. So the session that we're going to talk through today is the Access to Work Mental Health Support Service. This is something which your organisations can start utilising immediately after the session. It's not something which you've got to sign up to as an organisation. However, we are here to support you as a partnerships team to raise awareness of this service across your organisation. So for those of you who aren't aware of the Access to Work Mental Health Support Service, Access to Work are a Department for Work and Pension scheme who provide funding, usually in the form of grants, to support people with health conditions and disabilities within the workplace. So it could be that you might be supporting someone who needs some assistive technology for a visual impairment or dyslexia, and you could go to Access to Work and get some funding for that. It might be that someone needs taxis to work because of, say, something like epilepsy or even severe anxiety, and you may be able to get some funding from Access to Work for that as well. But when it comes to mental health, Access to Work provides funding for 9 months vocational mental health support, and that's delivered by Maximus, previously known as Remploy, who have delivered it since 2011. So just to give you a bit of an overview of what that support looks like. So when we say vocational support, what that means is that we are looking at the barriers which the individual faces and the difficulties that might be having in the workplace that's stopping them from thriving at work, attending and being productive. So it's not a clinical service. It's not there to provide treatment or diagnosis or offer the likes of clinical counselling. It's not going to replace occupational health or an employee assistance program, which might provide, say, 6 sessions of more emotional support. We hopefully plug that gap of, having a really hands-on approach, having someone to support an individual within your workplace for a long period of 9 months and helping them to get back to where they need to be, whether that be a more proactive approach of getting some support so that they don't go off work unwell, or it may be that they're already off sick due to their mental health or stress, and we're here to help them to get back to work. So a few differences there to some clinical support, which people typically associate with supporting mental health. It's also completely confidential, which we think is a really great selling point of the service. If you're talking to someone within your organisation who is struggling with their mental health, you can reassure them that we're not going to come back and discuss the ins and outs of their condition and how it affects them at work with their line manager or workplace buddy or mentor. It's completely confidential. That being said, we do fully encourage people to allow us to engage with their workplace. So if someone is really struggling with their mental health at work, the chances are is that engaging with their employer is really going to help in some way. That might be as small a thing as helping them to, raise awareness of a certain condition. It might be taking a bigger step and helping someone to disclose their mental health to their employer. Or it may be getting down to the nitty-gritty and getting some reasonable workplace adjustments in place and those more thorough return to work plans. But we don't do that unless we've been given consent to do so. So we respect the individual's wishes in that sense. If you were to if you was to start working with us as an organisation, one of the things that we can offer you is just some high level data. So we could say to you how many referrals we've had from your organisation in a given month or in a given time period. Perhaps it might be that you'd like to know like a mental health breakdown, how many people with anxiety have referred, how many people with stress-related concerns have referred, to help you work on your mental health strategy internally as well. So we can provide you with that sort of data and give that insight. We've supported thousands of people since it launched in 2011, and that's all through the excellent delivery of our vocational rehabilitation consultants, who I will refer to as VRCs throughout this presentation because quite a lengthy job title. But our VRCs are based all across England, Scotland and Wales. So this service isn't available in Northern Ireland, but across England, Scotland and Wales, our VRCs are there to support our customers for that 9-month support period. It's with the view that they will have the same VRC for the first 6 months, and then they'll have a different one for the final 3 months, but the same one. So you've essentially got 2 points of contact throughout your time. But Kayleen will talk in a lot more detail on the customer journey to help you understand, you know, what the program looks like and what that 9 months will feel like for the individual. But one of the things I just want to mention on this slide, and I'm sure you'll find it interesting and you'll appreciate that there's no financial contribution required by the individual or so customer or employer. So if you've ever worked with Access to Work before, you may have got that, say, assistive tech in for someone, and Access to Work may have said, oh, you've got to put 20% towards this because you're a larger organisation or something like that. When it comes to mental health support, it's not means tested in any way. So every single person who meets the eligibility criteria will be fully funded to have 9 months mental health support from us. And it's not as if you've got to pay up front and claim it back. It's literally all taken care of between Maximus and Access to Work directly. So it makes it really easily accessible for you all. If you could go on to the next slide for me, I'm going to run through what that eligibility looks like in a little bit more detail. So the first thing is that someone has to be in paid employment. Now, what paid employment looks like is quite broad, so it can be any hours, which is really good. It could be that you've got someone that works an 8-hour contract, someone that works a 40-hour contract, and they would receive exactly the same support from us. It's not, you know, reduced if someone works less hours or anything like that. We also support permanent and temporary staff. So you might have some agency workers, for example, that are just with you for a few months. It might be that they're with you for a few months over Christmas or another busy period. We can support them as long as it's their main aim to stay in work long term. You know, not everyone that comes through to us is going to be 100% certain that they're going to be in their job 9 months from now. But as long as it's their main aim to be in work, then we can support them. If someone did come to us and said, you know, I'm going to university in next month, or I'm going traveling, and they know full well that they're not going to be in the workplace, then we're probably not the right support for them, because we are a little bit more long term. We support self-employed individuals, apprentices, interns, again, as long as they're paid. That's absolutely fine. Apprentices receive exactly the same support as employees, but we do have they do have their own marketing materials. It's got the same phone number on and things, but if you've got a cohort of apprentices who you really want to target and you want them to understand that this service is for them as well, we can get you some of your own marketing material for them. We also support people who are attending work or signed off sick. So I've already touched on this lightly, but when it comes to being off work unwell, it doesn't matter how long someone has been off work for, as long as they have that contract of employment for us to help them to get back to. So we don't help anyone to find a new job on this programme. You know, we're not going to be job searching with people and working on their CV. It's all about getting them back to that contract of employment that they're already in and helping them return to the workplace. If someone was to change job roles within the organisation, we would move with them. You know, if they're at 6 months and they change job roles, they would just have the remainder of the 3 months on programme with us supporting them in the new role. And that goes for the same if they change organisation as well. We move with them. It's not as if it's cut short or anything like that. The other part of the criteria then, as well as the paid employment, is that someone has to have a mental health condition or be presenting symptoms. So what that means is that you don't have to have a diagnosis. So we could support someone who is potentially just having more bad days than good at work, just going through a turbulent time, but they might never have been to their GP, never have gotten a diagnosis for a formalised mental health condition. You may also have someone with stress, and of course stress is not a mental health condition, it's more a physiological response, but we all know that if not supported with, it could spiral and contribute to poor mental health as well. So we can support those individuals. On the other hand, you may have someone with quite a severe mental health concern, and that's also okay. There's not a certain condition that's excluded because it's perhaps we say, it needs clinical support. Many mental health conditions need clinical support, but we can operate alongside that clinical support because we are focusing just on that vocational element. So it's quite bespoke and it's quite targeted in that sense. So we often say, it really complements occupational health services, clinical counselling services that you might already have, as we're trying to have that hands-on approach. On here it says, your mental health could be affecting your productivity, attendance, general well-being in the workplace. And it's important to note that mental health might not be someone's primary health condition. So I'll just give you a little bit of an example at this stage, because there's so many people out there who, they're struggling with their mental health, but it might actually be because of a more physical health condition. As in a general sense, it could be that someone's got chronic pain and low mood, or it might be that they have a neurodiversity and therefore are quite anxious in social situations. But I actually supported, so I worked as a VRC myself previously, and so did Kaylina, who's going to be speaking to you. She, we've supported many customers, and one customer that I supported had actually been off work unwell because of a sudden onset of symptoms in relation to Parkinson's. Now, she'd been off work for 6 months, and when it came to coming back to work, it wasn't so much the physical symptoms that were stopping her, it was the anxiety around it all. What are my colleagues going to ask me about my condition? What have I missed whilst I've been away? How am I going to get to work now because my license has been removed? So one of the things we did was we actually managed to get them some taxis to work through the Wider Access to Work scheme. We also got them in touch with their local Parkinson's support group. So they were speaking to other people who had been through the same thing. But when it comes to the workplace strategies, what we did is we got in touch with the employer, and they were really supportive. So that kind of links to the last point on this slide, triggers not being linked to the workplace. The workplace itself was great. They were really helpful, really engaging with us, which is what we like to see. And, they allowed us to put some adjustments in place. Some of them, we worked them up together. One of them was that she could go to a safe space if she felt like she was going to have a panic attack on the phone. And we said, that's great, but what we wanted was a little bit more detail in that. So, she didn't want to have to explain herself to a colleague in that moment of feeling that way. So we had a little signal, which all team leaders knew what it meant, and someone would take her off the phones, no questions asked. We also got her to write a kind of like a short email to her colleague, her immediate team, just before she came back to work, so that she was just kind of saying, I'm coming back, this is how I am, looking forward to seeing everyone. And she got some really lovely responses, so that put her at ease. And because she could get to work and she had that support outside of work as well for the support group, once she returned, she sustained and she thrived in the workplace. So that's a good example of how mental health wasn't the primary health condition, but ultimately all of the things we did supported with her anxiety, and that triggers weren't linked to the workplace. There wasn't anything that the workplace did that meant that she'd gone off work. It was purely external. And that goes for things like childcare responsibilities, money worries, which we expect that we're going to see more of as a concern over the next coming months. We can support people with coping a little bit better with those feelings at work, having those conversations with line managers and getting those strategies in place. So hopefully that summarises the eligibility for you. So you've just got to be in paid employment, struggling at work because of your mental health or stress, diagnosed or undiagnosed. It makes it really easily accessible for the many rather than the few. It's a really great service. So Kaylina is now going to talk you through how you can refer to the service and also just some of the support and interventions that we might utilise for someone when they're on programme. So over to Kaylina.
Thank you, Beth. And can we just have the next slide, please? And we're going to look at how our referral process works and how you can get in touch with us if you think this might benefit you, yourself, someone you may know, a colleague, a family member, or even a friend. So as you'll see in the chat, our leaflets are coming through, and this is a great means if you want to download and share this leaflet to let people know that this service exists. There's a couple different ways that an individual can refer. So as you'll see on the slide here, we have a confidential helpline, email, and a self-referral portal. Now, absolutely, an individual can refer on behalf of themselves, and they can use any of those means necessary. They can even use that QR code that will be available on all the leaflets that you'll see downloaded in the chat. So they can put in that referral for themselves. You can share the leaflet for them to put in that referral, but just as well, on behalf of someone's consent, you can put in a referral for them. And this is great if you have things like mental health first aiders in your organization, if you have line managers that want to make sure you know that their colleagues are okay, their mental health is taken care of, especially while we embark on this winter season. It's perfect for you to absolutely do that referral for the individual because we know how hard it is to reach out for help. That's usually the hardest first step, right? So absolutely feel free to use those leaflets that have been shared in the chat. We will also have a recap email that will give you all of our promotional literature as well as toolkits. But just as well, say you want physical, professionally printed leaflets or posters, feel free to get in touch with us. We'll have our contact details at the end of the presentation, and you'll also be provided those contact details after the presentation is done through a recap email. Shoot us an email, say, hi, I would like to get 200 leaflets for my organization and posters. We'll send those out to you. Because the main focus of this support is to make sure that people can access mental health support that are struggling in the workplace by whatever means they want to do so. Now, when it comes to organizational and integrating our support service more into your business, we do things where we have a once a month designated day where vocational rehabilitation consultants will designate a day to your organization to answer those calls on any questions they might have about the support service or to see if the support service is going to be of benefit to them. So there's a couple different means, like I said, on how we can integrate our support into your organization or just how people can choose to refer however they want to do so. Now, another amazing aspect about the support service, on top of it being, completely funded, is that there's no waiting list. And this is probably one of the most rare things you're going to hear in 2022. There is no waiting list for this support service at all. We understand how important it is to put support into place immediately, especially when it is involving your workplace. So within 48 hours after that referral is put in, you are provided a referral appointment where we'll really discuss what's going on, get an overview of the situation, and get some basic information off of you. Now, like I said earlier, for those designated days for your organization, if we're integrated into your organization, we don't have to check eligibility for those individuals, as we already know they're getting it from their employer. So that designated day just kind of speedlights the process for your organization and just gives us an easier way to monitor what utilization we're getting through the support for your organization. So on the next slide, we're going to look at really what this journey looks like. So say you put in a referral for yourself, say you've put in a referral on behalf of someone's consent. Within 48 hours, you've had that referral appointment and you're moving forward through support. What does this 9-month journey look like? Well, on this slide here, you'll get a light understanding as to how we have it set up. So like Beth says, you do have one consultant for 6 months, and then you have another consultant for the 7th, 8th, and 9th month. Now, after the referral appointment, you're then provided one of our VRCs who develops an individualized support plan with you. So it's very transparent from the beginning of support as to what it's going to look like, what goals are going to be put into place, what core of support we're going to work on. And it really kind of gives you this light overview of what your 6-month journey is going to look like with this VRC. Once you go forward in that process, that is where your fortnightly review calls start to occur. So this is where you're working through those supporting interventions. It's where you're working through those coping mechanisms. We're providing those tools for you on dealing with your mental health condition in the workplace. So there's a lot of heavy intervention going on for those 6 months, which is why this is the only imagery that you have on this slide is for the 6 months. Months 7, 8, and 9, the frequency changes to once-a-month calls. And really the setup for that is to make sure what we've done for the 6 months has been a benefit to the individual. It's to make sure there's not a need to signpost to more support. And it's to make sure we don't need to put in another referral for this individual if they have a change of circumstances or if their mental health isn't getting any better. Now, for the first 6 months, when you're having those fortnightly review calls, you will see on this slide, it does say face-to-face. We can offer 3 face-to-face appointments, and we can meet at a mutual location, whether that be a coffee shop, whether that be, a library, if the employee is comfortable with it being in their organization. It's really about making it as accessible as we can. So you are definitely offered that, but you can also keep it completely virtual. You can utilize things like Teams, Zoom, texting, email, whatever means of contact you find to be most appropriate for you. Now, as well as that, with accessibility, we also have BSL, interpreters, hearing aids for support for people with hearing impairments so that they can access this support. Because really the premise of Access to Work is making sure that anyone can access their workplace no matter what physical or mental health condition that they happen to be dealing with. So you'll see that on this slide here, we've really set it up in a way that the individual knows what this journey is going to look like. You know what to expect, and it's very, very individualistic. That's why we do that support plan at the very beginning, because we want to know what you want to work on, and we want to know what we can do to provide you the best support. Now, if you go to the next slide, we'll look at what supporting interventions are included. Now, it would be virtually impossible to list everything our wonderful VRCs do for a 9-month period of time. I think we're all quite aware on this call how life can change within 9 months. It can be very as and what you need. It's very lenient to change with you. And that's why it's very open about the structure and the eligibility, because we want to make sure that we can help any individual that comes to our support service, no matter what they need, right? But on this presentation slide, you'll see a really light overview. And I say light because honestly, I'd have you here all day if I listed everything. A very light overview of what our wonderful consultants offer. So just to give you a brief understanding of that, we can help with wellness recovery action plans and wellness action plans. And these are great tools, especially if the employee consents us to talk to the employer, or if the employee feels comfortable enough to share these plans with their employer, to know what the mental health looks like when it's deteriorating, what things to put into place, and what best ways to tackle the mental health condition in the workplace for this individual. We also provide psychological well-being and self-esteem assessments at the first 6 and 9 months of support. And that's really how we're going to gauge how this support is working for that individual. And that's how having those fortnightly review calls as well, we can try one thing. If it doesn't work for that individual, well, we can try a different route, right? That's why we're having that consistent communication with that one consultant. We do mindfulness tools. We have an employment support hub that you are given the login codes for as soon as you sign on to support with us. And you're free to use that past the 9 months and however long you see fit. And that, in essence, has well-being resources on it, online CBT resources. It has employment tips and tricks with dealing with certain mental health conditions. And it's just a wide plethora of resources for individuals to tap into in between those appointments that we're having on that fortnightly basis. So there's consistent resources coming through for individuals. Now, like Beth said, we can absolutely help with employer guidance for reasonable adjustments. That being said, we do not get involved in legalities and we cannot delegate things, right? So it is based on a recommendatory basis. But a lot of the time it is reaching that common middle ground with the employer and the employee. And it's just having the support to bring up these very sensitive, tough conversations. So it could also be very minor adjustments, right? We're not talking about massive things here. It could be, you know, like Beth said, having a room for someone to go to when they're having a panic attack. Very minor things that can have such a massive effect on an individual's mental health. Now, we do get often asked, where do we fit in with an occupational health and an employee assistance program? And I know Beth touched on that a little bit. So just to build on from that, we absolutely complement those resources. So if you want to think of occupational health and your employee assistance program as phase one, your clinical support, your clinical realm of support, getting that in place first and foremost, then consider us phase two. So say you finish your employee assistance program sessions, you still need mental health coping strategies for the workplace, absolutely feel free to get in touch with us and we can help you with that. Say you've had your occupational health assessment and you need help putting in those interventions that have been put into place by occupational health. We're more than happy to get in touch afterwards and help you with the longevity of those supporting interventions. So we really work in the same realm of occupational health and EAP. What we're trying to do is provide the most support that we can for individuals in any way necessary that benefits them the most, right? So we do want to utilize those clinical resources because they are fabulous at what they do. We're not taking their spot. We're simply complementing them and giving that added measure of support. Now, like Beth said, the Mainstream Access to Work does have a different referral and funding process, but our consultants are well versed in this resource. So things like workplace assessments and equipment, holistic assessments, job coaching, support workers, travel support, training courses related to mental health. Like Beth said, as a BRC, she got an individual travel support, which would have had a massive impact on her mental health. We're gonna look at the bigger picture here. How best do you access your workplace physically and mentally? And like I said, even though it is a different referral and funding process, our consultants are well versed in that, and they're going to look at all the resources we can utilize to make sure you have the best workplace you possibly can. Now, last but not least, of course, we can always signpost your EAP. We do want to get involved with those resources you have as an organization. We want to utilize those resources, right? Because it takes a village to really help people with mental health. We all have to be working in some realm together for the greater good of people's mental health. So absolutely, we can signpost to your employee assistance program. We can absolutely get GP support involved. And last but not least, we can signpost to mental health charitable organizations in your locality. So if you are anyone that has dealt with a mental health condition, if you know someone that has dealt with a mental health condition, you know the toughest thing to do is know who to turn to, where to turn to, and what resources to utilize. Our VRCs make it so you don't have to go searching for those answers. They provide them to you and you can just focus on getting better. So on the next slide, we're just going to look at some coping strategies that we utilize. Now, this is kind of like a two-part term on how we try to benefit individuals in the workplace that are struggling with their mental health. So not only are we going to focus on the mental health side, we're going to try to give you those skills, practice those skill sets for the actual workplace. So things like dealing with change, communication, and working with others. And a lot of this is focused around building up that self-esteem and practicing those communication skills. Time management, organization, planning, and prioritization of tasks, and taking instructions. So as you'll see on that aspect, the actual workplace aspect, it really is having to use those resources and those tools and that practice to put those things into place and make your skill set stronger. And if you're talking to an individual on a fortnightly basis, you'll have that person, that reassurance and that guidance that you need to get those skill sets where they need to be. And that can have a massive effect on how you can handle your day-to-day workload. Now, on the other side, you'll see that's more of our mental health coping strategies, things like relaxation and fatigue management, memory aids and strategies, another practice we want to put into place, management of treatment and medication, not clinical, just to clarify, like Beth said at the beginning, this is not a clinical support, but it's that reassurance and that guidance. And it could also be the educating to the employers about certain side effects, things that might affect the individual in the workplace. you know, that medication might be causing, you know, memory fog, things of that nature. It's really about trying to understand what's going to work best for this individual, what they're dealing with. Mood and behavior management, things like mood diaries, anxiety tracking logs, really looking for trends in your mood and how you feel to see how we can tackle it and what's going to work best for you as an individual. And then anxiety and stress management. You know, a lot of these tools that we're giving on this slide are things that take practice. It takes someone giving you that guidance. It takes that reassurance. And that's exactly what we're trying to do in this support service. Now, on the next video, you'll see we have a video of our organization that encompasses everything that we're discussing today. And then we'll be more than happy to take any questions you might have and, you know, just better explain the support if anyone needs any clarifying.
It's just a normal day. All work and no play. All of a sudden, I feel numb. Recently, everything seems glum. It's 10 AM. My next meeting is due. Put my camera on, muddle on through. Each time I speak, my throat feels dry. I just feel like I'm living a lie. My manager notices, bags under my eyes. She questions me, and I start to cry. I admit to her I have not slept and confess how my anxiety has crept. I can feel the shaking in my hands. My chest feels heavy as we make plans. My manager makes a referral to the Access to Work mental health support service. I feel nervous. I get a telephone appointment. They tell me they support mental health in employment. I'm introduced to their consultant, who makes me feel I am important. As I start to explain what I'd most like to gain, she completes a support plan for me, which is as personalised as can be. For 6 months, I can see. I get contacted bi-weekly with different resources and advice. I slowly start to regain my life. As my mental health improves, my anxiety, it starts to lose. I move on to the Light Touch team, and once a month they contact me. Through their continued support, I can battle any negative thought. When my 9 months comes to an end, my mental health becomes my friend. Contact our Access to Work mental health support service team today.
Lovely. Hopefully you found that that kind of encapsulates what we've both just ran through with you. We can see that a few messages have popped up on the chat. Whilst we're going through those messages, if you could just move on to the final slide for us. You've got Kaylina's details on there. As mentioned, you will get a full recap email. You'll also get our new employer toolkit included in that with lots of resources. However, you may want to note down those details today, especially if this is a recording as well. So just to run through some questions, and we'll try our best to answer them for you. And if we can't, then we'll let you know. Or if you'd prefer to ask us a question offline, anonymously via email or phone call, then please do just reach out to us. So one of the first questions is, what is the area of expertise or training background of the VRCs? And can we advise patients to self-refer for ergonomic assessments related to musculoskeletal issues causing stress or a decline in mental health? So that's a really good question. Our VRC network, well, our team of VRCs, they are from a variety of different employment backgrounds. So there's not one set qualification or degree that you have to be a vocational rehabilitation consultant. It's about having that experience and competencies in supporting people with complex needs within the workplace. service. Now, some people may have done that within a physical, with physical disabilities and health conditions. Others may have supported within that clinical mental health setting before. Other people may come from a mental health training and advisory background, and they've got that experience of motivating and building confidence within people. To give you an example as well, I used to work as a VRC myself, as I've given some examples, and I was very much trained up by the organisation. I started as an in-work support advisor, getting recommendations and assistive software in for people going into work and helping with their training, and progressively moved into mental health and becoming more competent in that area. So when it comes to, can you advise people to come to self-refer in order to get ergonomic assessment, if I'm reading that right, if someone was to need an ergonomic assessment, what we would do is advise them to reach out to the wider Access to Work scheme. So if you've got someone that needs that support, you can either come directly to us and then we will help them to get in touch with Access to Work, or if you were to contact Access to Work directly initially, then they could get the ergonomic assessment and Access to Work could refer through to us if they identified that their mental health needed a little bit of support as well. So hopefully that makes sense for you and answers that question.
Awesome. So we have, how do you chase up the referral? Well, it would depend on that being a referral that you've put in yourself, or if you've put in a referral for someone with their consent. Now, if you've done it for yourself, you can absolutely use the email that we're going to provide in the recap email, which is a Maximus email. Now, if it is someone else's referral that you've put in for them, without their consent, we can't really communicate that referral. So I wouldn't be able to tell you if they've signed on to service or if they were receiving support and what report they were receiving, because our main premise is that confidentiality. So we want to make sure everything that we do is with the mind that we are taking care of a really sensitive topic here. So that just kind of chases how we would, try to chase up a referral. But if there ever is in any issue a referral, or if you feel like you've been waiting longer than the 48 hours, like we said, our email, if you want to go to the next slide, I think my email will be on there. You can feel free to contact that work email, or if, I don't know actually if it's gonna show. So what we'll do is provide it in the recap email that will have our script and our work email, so you can contact us in that realm as well. So there'll be a different means as to which you can get in touch with us for that. The next question, are you finding that employers are receptive to an additional layer of support on top of existing employee assistance programs? Absolutely. So most of the organizations we work with have an employee assistance program, and we are partnered with some massive organizations in England, Scotland, and Wales. So majority of them have employee assistance program and occupational health therapists, and it works extremely well because we have that relationship. There's some employers that we work quite closely with their EAP and their occupational health. Some employers do the referrals for individuals through their occupational health program. When it comes to the EAP, we've worked with EAPs before to, just know who we're working with, who to signpost to when we want to receive that clinical support for that individual. So we always like to utilize the resources the organization has. But yeah, we are just that additional layer of support, that longevity of support. So if someone's finished their employee assistance programs, they can come to us as that phase 2, like I said. But maybe just as well, they don't want that clinical realm of support and they're just feeling out of sorts and low mood, and they just want, just that longevity of support of someone to talk to and that reassurance. They can go about it that way. So it's very individualistic in that manner.
Yeah. Lovely. And I suppose it's one of those as well, whereas if you start working with us as an organisation and for whatever reason it isn't working for you, it's not something you've signed a contract for or anything. We're just working in a mutual beneficial partnership. So we will support you as long as it works for you. That's the main thing. So I'm just going to see what other questions we have here. Is there a limit to how many individuals you can support in an organisation? So with this service, there's no cap on it. We support hundreds of new customers a month from a variety of different sized organisations, and the amount that we can take doesn't vary based on the size of your organisation or whether you're public or private or anything like that. If you're on here from a government organisation as well, you may be limited as to which Access to Work services you can provide. So if you did need ergonomic ergonomic assessments and things. You might not be able to get that through the wider Access to Work scheme. However, all government departments such as HMRC, Home Office, Ministry of Defence, you can access the mental health support service. No one is excluded from this element of the Access to Work service. So I do often get that sort of question when we're on here, but yeah, no caps or anything. So you can take as many referrals as you need. And there's another question here about the video. So within our toolkit, you'll have a variety of videos. That's right, isn't there? The videos are on there. Yeah. You'll have a variety of videos, leaflets, posters, intranet visuals, case studies, all sorts of things that you can use to get this message across. So this is quite an emotive video. We've also got ones that are a little bit more, more like a bit of a slideshow that you could put on a TV screen and people could see those visuals as well. So there's lots of things to help you to raise awareness across the organisation. So yeah, someone asked about the civil service. So hopefully we've covered that. If you're civil service, you can access this. You might not be able to access the wider Access to Work service, such as taxis, assessments, but the mental health, you 100% can. Yeah.
Are you running more webinars so I can share? Absolutely. So we do a once a month Eventbrite webinar where we go through the same presentation that you've seen right now, but just as well, if you want us to do a presentation specifically for your organization, we are more than able to do so. So you wouldn't have to pay for anything. There would be no funding. It's completely free for us to host a webinar for you, 30-minute webinar, where we go over all the material that you need, as well as a Q&A. So if you want us to provide this presentation for your organization, please feel free to send an email back to the work email that will be provided to you, whether that be Beth or me, because we're more than happy to discuss this support. It needs to be well known. It's a wonderful support service. So absolutely.
It might be that you would like us to do it to like occupational health, HR, managers, or as Kalina mentioned earlier, like mental health first aider networks and things like that. Sorry, I've just lost where I was on the chat. Let me just find where I was. So yeah, we're here to help wherever you need us. Yeah, so Access to Work waiting times are separate to our own. We don't have those waiting times. It's just you get your appointment within 48 hours. And I believe Access to Work are working really hard to improve upon that waiting time as well.
I think that's all the questions.
So I think that's all the questions. So on that note, it's just for us to say thank you so much for joining today and for taking the time to hear about our service. You'll receive the recaps and please do share our resources far and wide, and it would be really great to hear from you and hopefully work with some of you moving forward and help you to support more of your employees. So many thanks.
Thank you all so much. Enjoy the rest of your day.
Thank you.